there has been an outbreak of Ebola in the United States. Here's the president.
My fellow Americans, the Ebola virus is in the US, but there is no reason to panic. I'm confident it will not cause an outbreak. We have an advanced healthcare system with isolation units and protocols in place. We are prepared.
The president has confirmed the Ebola outbreak. Now a briefing from the Center for Disease Control.
This isn't an outbreak. Ebola is scary because it causes such a severe disease, but here we have one confirmed case that is being handled with isolation. We have the healthcare infrastructure and public health capabilities to stop the spread and prevent an outbreak. That being said, this is what you need to know to do your part to prevent the spread. First, do not travel to any place or country where this disease is high. If you must travel, do your research about that specific area and see if there have been any recent outbreaks. If you are already in an area that has been affected by the disease, it is extremely important to avoid contact with an infected person and any bodily fluids such as blood, urine, sweat, or saliva. Once you return from your trip, you will need to monitor your health for about 21 days, and if any symptoms may arise, you need to seek medical attention immediately. Thank you.
Today, we have two special guests with us, infectious disease expert Dr. Carol and physician and Congresswoman Dr. Sam, to provide us with more information for this Ebola outbreak. Dr. Carol, what is Ebola? Who gets Ebola? Just how worried should we be about this outbreak?
Ebola is a virus that causes a severe hemorrhagic fever in humans. The first reported Ebola case was in 1976 in the Democratic Republic of Congo. However, literature suggests that the virus existed long before the first reported case. The original source of the virus is believed to be in bats.
Bats? So how did it get to people and how did it get here?
This is what we call a spillover. A spillover is where a pathogen moves from its original reservoir to the human population. It probably made that move through people handling and butchering infected animals. It typically infects sub-Saharan African countries at a higher rate, but people traveling between countries can spread the disease to other regions. Healthcare workers are especially vulnerable.
Yes, it looks like the source of this current outbreak points to a doctor who traveled to Africa to help with that outbreak.
Yes, I'd like to point out that this isn't actually an outbreak. Here we have one confirmed case that is being handled with isolation.
But should we believe the president and CDC? What about the 267 passengers on the plane with the doctor? Have they been accounted for? This disease is very contagious. What are the typical onset of symptoms so the public knows what to look for?
Well, that's the tricky part. Many of the symptoms associated with Ebola are also associated with illnesses we see all the time, like the flu. This includes fever, headaches, muscle pain, fatigue, vomiting, and stomach pain. Depending on the patient, symptoms might take up to 21 days to appear. As it worsens, the patient starts experiencing internal and/or external bleeding.
It is very contagious, but an infected person cannot spread the virus until they show symptoms. The doctor did not show symptoms on the plane.
Right. As soon as she developed the symptoms and knowing she was at risk for exposure in Africa, she knew to go to the hospital and isolate. Like the president said, an outbreak is not likely in the U.S. There is no reason to panic.
How does the virus spread?
It spreads through bodily fluids such as saliva, vomit, blood, and semen from infected individuals who show symptoms. You can't get it from the air.
Those recently deceased from the disease are also extremely contagious. Part of what has contributed to the spread in West Africa is traditional burial rituals there.
All right, let's take some calls from viewers concerned about this Ebola outbreak.
Hi there. Is there a cure for Ebola?
As of right now, there is no known cure for the disease, but there are a few things that can be done within the hospital to reduce the symptoms and to hopefully allow a patient to eventually recover. Unfortunately, there is no antiviral drug to treat Ebola, and recovery depends on the patient's immune system and how strong it is.
What does treatment look like?
The treatments is to receive many fluids and electrolytes through an IV. It is extremely important to keep hydrated at this time. Dialysis or blood transfusions are another treatment. This can help extract waste from your blood that can be infected. Oxygen flow is also important when being treated with Ebola, so oxygen therapy may be administered. Doctors may also give you medication to help keep your blood pressure normal, help reduce vomiting and diarrhea, and to manage pain and fever.
Yes, I have 2 questions. How does a virus cause bleeding? And how do I make sure I don't get Ebola?
Great question. So viruses depend on hosts to replicate. The virus gets in your cells and it hijacks them to create more copies of itself. Ebola in particular targets specific cell types such as liver cells, immune system cells, and endothelial cells. These are flat cells that line blood vessels and body cavities and serve as barriers. Ebola stops the cells from sticking together like they should, and since they do line the blood vessels, this is what causes dangerous hemorrhaging. The other symptoms of Ebola come from attacks to cells that clear out toxins.
As the CDC director said, don't travel to any place or country where the disease is high in risk. Avoid contact with an infected person's bodily fluids and any items like clothing, needles, bedding that may have come in contact with an infected person's bodily fluid. Avoid contact with animals that carry this disease like primates and bats, their bodily fluids, and meat that may have been prepared from these animals. If you have reason to believe you've been exposed, monitor your health for about 21 days, and if any symptoms may arise, you need to seek medical attention immediately.
And that's all we have time for today. Thanks, doctors, for joining us.